It's been 3 years since UT Health started providing medical care at the Smith County Jail, replacing a problematic third-party vendor. In the last few years, improvements have been made, especially when it comes to mental health. But as county commissioners learned this week, there is still more work to be done.
The Eighth Amendment makes it a legal obligation. Jails must provide medical care to inmates.
If you don't know, all of our inmates have access to tablets, and at any time they can put a request in to see a medical provider.
Carol Henson oversees medical operations at the Smith County Jail, which has used UT Health East Texas since 2024.
We have been able to stabilize our expenses, especially in the areas of pharmaceuticals and supplies.
In addition to saving taxpayer dollars, Henson thinks their biggest win has been a decrease in behavioral health emergencies, with a psychologist at the jail Monday through Friday, plus rotating interns.
We have restraint chairs. We hadn't had to use a restraint chair in over a year.
Chief Deputy Gary Pinkerton says that's a big change. It wasn't that long ago he was telling us about inmates self-mutilating and banging their heads against the wall. And while the county celebrates the successes, challenges remain, including staffing, especially when it comes to overnight nurses.
Irregardless of what I think, I love the jail. Not everybody wants to come work in the jail setting.
Another challenge, the severity of inmate medical conditions, with some fighting cancer, renal failure, and AIDS, with the county in some cases paying $30,000, if not more, for one inmate's medication.
And those individuals receive care that is second to none. I believe we do the best that we can with them, but also that care comes at a cost.
Henson hopes to seek out relationships with UT Tyler and TJC to expose nursing students to providing medical care in a jail setting.